The Department of Medical Assistance Services, or DMAS, would like to welcome you to the Employer of Record Paid Sick Leave Training. This information is presented by the DMAS Office of Community Living. Our goal today is to ensure that you have the tools needed to provide sick leave training to your attendants. The purpose of this training is to provide guidance to employers of record, attendants, and services facilitators for the new paid sick leave benefit. House Bill 2137 was passed by the 2021 Virginia General Assembly and requires eligible consumer-directed attendants to be provided with paid sick leave. This sick leave training will focus on those serving as an employer of record for qualified services for Medicaid members. In today's training, we will discuss sick leave eligibility determination, earning sick leave, using sick leave, important eligibility and usage dates to remember, roles and responsibilities for fiscal employer agents, or FEA, and employers of record, or EOR. We will also provide some frequently asked questions and share several sick leave resources. Who is eligible for sick leave? Sick leave is available for consumer-directed attendants who work an average of 20 hours per week or 90 hours a month. Eligibility is determined by the number of hours the attendant works during a quarter. This includes all consumer-directed services, personal care attendant care, respite, and companion services. What is a quarter? A quarter is a grouping of 3 months. There are 4 quarters in every year. This timeline provides the schedule for the sick leave eligibility period. We will talk more about this schedule later in the presentation. Determining who is eligible. Some attendants work for more than one employer of record. Determining eligibility for sick leave is based on the number of hours worked for each EOR during a quarter. These hours are assessed separately and will not be combined. There are 2 ways to determine if the number of hours worked meet the minimum requirements to qualify for sick leave. Pathway 1. An individual will qualify for sick leave if they work an average of 20 hours a week for all 3 months in any quarter. Or, Pathway 2, an individual will qualify for sick leave if they work at least 90 hours per month for all 3 months in any quarter. Eligibility determination. At the end of each quarter, the payroll vendors will conduct an assessment of the hours worked by the attendants to determine who is eligible to earn sick leave. It is important that attendants and EOR submit and approve shifts in real time to ensure all hours worked in the quarter are included in the eligibility calculation. The eligibility calculation period for each FEA begins on the 21st day after the quarter ends. Each FEA will need adequate time to complete their sick leave eligibility assessments for each attendant. This is why all time worked must be submitted and paid by the 20th day of the month following the end of the quarter. Assessments will begin promptly on the 21st day to give each FEA time to process all payroll from the previous quarter. Key assessment points. If an attendant does not meet the initial sick leave eligibility in the first quarter, The FEA will reassess them each quarter to determine if they meet eligibility. Once an attendant meets the qualification criteria for sick leave, they remain eligible until the end of the fiscal year. Virginia's fiscal year starts July 1st and ends June 30th. Eligibility is reassessed every fiscal year. Now that we've determined who is eligible, we will now discuss how sick leave is earned. Fiscal employer agents determine the initial number of sick leave hours earned after an individual becomes eligible for sick leave. Eligible attendants earn 1 hour of sick leave for every 30 hours worked during the qualified quarter. Accrual of sick leave is retroactive to the start of the qualifying quarter. After eligibility is established, accrual will occur every pay period. Earned sick leave hours are available to use the first day of the second month following the end of the qualifying quarter. All consumer-directed fiscal agents, Access, CDCN, and PPL, determine the number of awarded sick leave hours based on the number of qualifying hours worked that were submitted timely. Fiscal agents will track these hours submitted to ensure an attendant meets eligibility. Calculating sick leave hours. Eligible attendants earn 1 hour of sick leave for every 30 paid hours worked. For example, an attendant that worked 90 hours will earn 3 hours of sick leave. An attendant that worked 300 hours will earn 10 hours of sick leave. Let's demonstrate a retroactive awarding of sick leave hours. During the third quarter, January 1st to March 31st, an attendant worked a total of 330 qualifying hours. The attendant's sick leave accrual is calculated from January 1st through March 31st. The attendant's eligibility is determined in April, which is the month after the end of the quarter. The attendant has earned 11 sick leave hours. The attendant may use the 11 sick leave hours as early as May 1st, which is the beginning of the second month after the quarter ends. Sick leave hour accrual example 1. During the second quarter, October 1st through December 31st, the attendant worked a total of 320 hours and qualifies to earn sick leave. The attendant's sick leave accrual will start from October 1st and be calculated through December 31st. The attendant will have 10 hours of sick leave available starting February 1st. We will now discuss the details of how hours are calculated later in this presentation. Sick leave hour accrual example 2. During the third quarter, January 1st through March 31st, the attendant worked a total of 266 hours and qualifies to earn sick leave. On May 1st, the attendant will receive 8 hours of sick leave. This chart shows the reimbursement cutoff for hours worked as well as the date earned sick leave is available for each quarter. Please note all time entries for a quarter must be submitted and paid by the 20th day after the quarter ends. For example, quarter 3 is from January 1st through March 31st. Any time for this quarter submitted and paid after the reimbursement cutoff date of April 20th will not be included in the FEA sick leave eligibility calculation. The following process is outlined to provide guidance for receiving payment for earned sick leave hours. Following these guidelines will help to ensure appropriate sick leave eligibility and hour calculation. Attended work hours are submitted to the EOR each week. The EOR submits approved hours to the fiscal agent every 2 weeks. Late submissions will affect the attendant's eligibility for sick leave. This may make the attendant ineligible. The FEA processes payroll and provides reimbursement. Approved and submitted hours worked must be received by the 20th day of the month after the quarter ends in order to be included in the eligibility determination assessment process. For example, all hours worked in July, August, and September must be received by October 20th to be included in the sick leave calculation for quarter 1. The FEA will begin sick leave calculations on the 21st day after the quarter ends. Sick leave hours are available for use on the first day of the second month following the end of the quarter. Sick leave will then accrue at the end of each pay period going forward. We will now discuss the usage of sick leave. When may an individual use their sick leave hours? House Bill 2137 provides specific guidance detailing the purpose for sick leave usage. An attendant may take leave for themselves or for a family member like their child, parent, spouse, etc. Here are some important sick leave hours notes. Sick leave hours may be used in 15-minute increments. For an example, an attendant may use 30 minutes of sick leave time instead of having to use a full hour. Sick leave must be submitted within 30 days of using it. Timely submission will ensure the FEAs have adequate time to calculate and deduct used sick time from an attendant's accrual balance. This also ensures all system reporting available to the EOR is accurate. Attendants may earn and use up to 40 sick leave hours in a fiscal year. This means that regardless of the number of qualifying hours worked, an attendant may not accrue more than 40 hours per fiscal year. Carrying over sick leave hours. An individual may use up to 40 hours of earned sick leave per fiscal year. Any unused sick leave hours at the end of the fiscal year will be carried over into the following fiscal year. Please note, no more than 40 hours of sick leave may be used in a fiscal year, including when an individual has accumulated a bank of more than 40 sick leave hours through carryover. This is an example of how sick leave hours may carry over into the following state fiscal year, or SFY. The attendant has earned the maximum 40 sick leave hours for the fiscal year that ends June 30th. During the year, they use 30 of those hours, leaving a remaining 10 sick leave hours. These hours will carry over at the start of the new state fiscal year that begins July 1st. The attendant may now earn up to 40 additional sick leave hours in the new state fiscal year. We will now discuss FEA and EOR sick leave responsibilities. Each EOR member and attendant must be enrolled with a consumer-directed FEA. Managed care members are using CDCN, PPL, or Access based on the member's MCO enrollment. Fee-for-service members use CDCN as their FEA. Each FEA will be responsible for the following sick leave process tasks. They will train EORs and attendants on sick leave submission process. They will calculate attendant sick leave eligibility. They will create an internal system to track and calculate all weekly and quarterly attendant hours submitted or denied for payment. They will generate sick leave reports for EORs. They will issue paychecks for eligible and timely submitted sick leave hours. And they will provide support to EORs, service facilitators, and attendants for the sick leave process. The FEA will provide training, technical assistance, and printed resources to EORs and attendants. They will also provide support to the service facilitators during this process. EORs have an important role in sick leave benefit management. It is recommended that the EOR review sick leave expectations with their attendant prior to November 1st, 2021, or upon hire. Here are some key points for review. Attendants are responsible for notifying the EOR of sick leave requests prior to using the hours. This allows EORs an opportunity to contact another attendant to work the shift. The EOR may ask the attendant to submit the request for sick leave verbally, in writing, electronically, or by any other means agreed upon between the EOR and attendant. This process is identified during the hiring process. When possible, the attendant shares with the EOR the total amount of anticipated time to be used for sick leave. For example, an attendant may make a request to the employer if they expect the usage of sick leave to last for a specific amount of time, such as 12 hours or 2 days. When an attendant uses 3 or more consecutive days of sick leave, the EOR may require documentation demonstrating that the paid sick leave was used appropriately. Attendants are not required to find shift coverage when using sick leave. Attendants are not required to work alternate shifts or to make up work hours for sick leave use. EORs track and approve all eligible sick leave hour requests for attendance. Here are some continued EOR key points. EORs may not retaliate against an attendant for using sick leave. The EOR may not terminate, discipline, threaten, discriminate against, or penalize an attendant because the attendant requests or uses their sick leave. Sick leave will not be paid upon termination. If an attendant has a sick leave balance on the day of termination, the sick leave balance will not be available to the attendant. Let's review some frequently asked questions attendants may have regarding paid sick leave. Fiscal employer agents will provide additional FAQs for your convenience. If I do not qualify initially for paid sick leave, will I have another opportunity to qualify? Yes. Eligibility criteria will be evaluated on a quarterly basis until eligibility is met. Once I qualify for paid sick leave, how long does the qualification last? Once an attendant meets the eligibility criteria for sick leave, they remain eligible until the end of the current fiscal year, which is July 1st to June 30th. Eligibility is reassessed every fiscal year. What's the total amount of sick leave hours I can accrue? Attendants may accrue up to 40 hours of paid sick leave in a fiscal year. Can I roll any unused sick leave hours over to the next fiscal year? Yes. Attendants can carry over any unused sick leave to the next fiscal year. However, they can only use a maximum of 40 hours sick leave per fiscal year. How do I submit my sick leave hours for payment? Sick leave must be submitted via the web portal. Attendants may submit unused sick leave hours within 30 days. Sick leave hours submitted for payment after 30 days will be denied. What happens if I only need to use 30 minutes of paid sick leave? Do I have to use an hour? No. Sick leave may be used in 15-minute increments. Can I use paid sick leave if a member switches EORs? Yes. The paid sick leave remains with the attendant and should transfer to the new EOR. If the consumer switches to a different managed care organization, will I keep my sick leave hours that I've already earned? Yes, a transition process is in place. How will I know how many sick leave hours I have available to use? Sick leave hours are displayed on an attendant's pay stubs and can be accessed via the web portal. If I'm terminated, can I get paid for any unused sick leave? No. Unused sick leave hours cannot be paid out upon termination. Will more information or training be provided regarding sick leave? Yes. DMAS and the payroll vendors will provide training for members, employers, consumer-directed attendants, and services facilitators starting in August 2021. Can I get overtime when I use sick leave? No. Sick leave is not counted as time worked and will not be included when calculating overtime payments. When I use my sick leave, will my patient pay obligation be deducted? Yes. Patient pay will be deducted from the attendant's pay even if sick leave has been used. We have compiled several paid sick leave resources you may find helpful. Stay tuned. All fiscal employer agents will provide additional sick leave training, forms, and other resources in late September or early October 2021. Sick leave benefit technical assistance questions may be directed to the following Fiscal Employer Agent or FEA contacts: Consumer Direct Care Network, Access Financial Management Services, and PPL Partnerships, Public Partnerships LLC. For additional assistance related to this training, please use the resources below. DMAS, Department of Medical Assistance Services website, DMAS Consumer Directed Employer of Record Manual, Department of Medical Assistance CD Attendant Help email box. Thank you for participating in this training and your continued work with DMAS Medicaid members and personal care attendants.